So, with very good wishes, we like to invite all of you today to our very exciting session. And definitely, this is a very exceptional session also. After the end, you will find that these today's discussion topics are not only useful only for the examination candidate of AKT or OSCE. Rather, in general, those who are doing the general practice as a family physician, all of you can get the benefit from the topics. And our selected topic is a very common hypertension, a symptomatic killer disease of human. So we have chosen it for the first time. First time means topic is not new, old topic, but the design of class is for the very, very first time. And I don't know, you will understand later. Did you attend such topics before or not in this pattern? So we expect your connectivity, active participation until the end of the session. So we like to start now. Get ready, please. And with my humble introduction, already you know, and we are going to there. This instruction institute and the moral alert, and we like to start, first of all, very important issues for the AKT candidate. And the AKT candidate and other colleagues, those who are here, don't be frustrated. We have selected some topics. It is called the traps and rescue, though designed for the AKT exam, but it is a real time situation. Moreover, the informations will be discussed here important as well in the OSCE exam also. Though we have today some OSCE separate presentation and separate discussion. So these are very reciprocal. Both way are important. Any topics today, any presentation today, important for the AKT OSCE examinee. Moreover, for the GP. So go with us for the first topic now. And definitely, I like to expect a little response from you. Anyone can actually share your opinion. This is a trap means very tricky thing, not complicated, rather to say the tricks. So you see one patient, the how they trap you. Trap you means examiner design the question. Blood pressure recorded once 168/96 in the clinic. There may be other information. 65 years patient presented to you, so and so. But the theme or core message is like this. What examiners want, you do not diagnose hypertension on one reading. This is the expectation of the examiner or question setter. So best next step will be a BPM and home blood pressure monitoring unless emergency and organ damage. So from there, correct answer thinking, what correct answer? That confirm with out of office BP monitoring before labeling hypertension. That means you will not label the blood pressure as hypertension. So that could be a question in the AKT as well as in, you have to face the same scenario in the OSCE exam also. This is one question just for you now, and let's see the next one. So actually now I like to request anyone to read it on behalf of me who will be very kind enough to read the question. Question means the topics, please, so that it will be more inbuilt. Who want to read, please? Doctor? Nobody? Nobody can hear me now. It would be better if anybody can read for me. So they mix the number, you see, measurement in the clinic measurement. Someone to tell.
Yeah, doctor, I can
Yeah,
try.
Dr. Sarah, thank you, doctor. Very, very nice to. So you please just
Yeah.
discuss the topics.
Yes. Clinic BP versus ambulatory blood pressure
Pressure
monitoring.
monitoring.
Yes. And measurement in the clinic, if it is more than 140 by 90, we consider it as hypertensive. Then, do you want to elaborate more on it?
This is the average daytime
Yeah,
ambulatory blood
equal or more
pressure.
than that. Yeah, daytime 140 by 90, clinic BP, then it is hypertension.
Yes.
Then, if it is like that, then we go for, if it's one reading, then we suggest ambulatory blood pressure monitoring, daytime average,
Right.
which is above 135 by 85, equal or above. Then, uh, yeah, we consider that.
Actually, these are the cutoff values for
Mhm.
labeling hypertension
Yeah.
in different environmental setup. Okay, this is the theme. From there, how to make the trap for you. They will show 138 by 88 on ABPM, or and they expect you to say not hypertension. So what is your job now? Dr. Sarah, can you raise your hand? Dr. Sarah possibly was talking so that I
Yes,
can
doctor.
identify you. Raise your hand, doctor, in the system, in the Zoom, so that it will be easily visible to me. Just raise your hand in the Zoom. So you see, they make the trap in this digit in the figure. If you cannot remember this thing strongly, there is every chance that you will make the answer wrong. Yes. Yes, doctor, not possible to raise the hand? Open the mic.
No, I can't find it. Yeah.
Can't find is a
The raised.
reaction button there.
No. Yes. Okay.
Yes. Thank you.
Okay,
So
found it.
got it. So Dr. Sarah, can you Sarah, I'm sorry, if Sarah or Farah
I'm
have
Sarangi. Yeah,
yeah,
Sarangi.
Sarah. So I think all of you
Yeah.
understood what we mean. These are simple tips. We will not discuss detail. The third one, Dr. Sarah, can you continue?
Yes.
Just to discuss the topic.
Yeah. White coat versus masked hypertension. Then, what is white coat hypertension? If
Clinic
when you see the
BP
doctor, yeah,
high,
when we,
ABPM normal.
yeah, when you see the doctor, it could be high BP, but
Mm.
at home, when you empty blood pressure monitor, it's normal. Then, masked hypertension. In the clinic, when doctor measure it is normal, but ambulatory BP monitoring, it is high. Masked hypertension. Mm.
And the
That's
trap
what it is.
word, how they create a trap for you in the exam.
Yeah.
They have
In the clinic, it's high
they give
BP. At home,
BP
it's
high
normal.
BP in the clinic, but normal at home.
Yeah.
So what is the correct diagnosis and the management? Now, other
So,
colleague, please, you can share. Dr. Sarah, be connected, please, if you don't have any problem. Dr. Sarah, keep your mic on, please.
yeah, yes, doctor. Yeah.
And actually, raising the hand. You can keep raising so that your name will be in the top listed here. So anybody who can open the mic, please. Correct diagnosis. What diagnosis? Now you understood. Diagnosis is yes. Thank you, Dr.
White
Sarah.
coat.
Open your mic. Open your mic. Diagnosis
White
here.
coat.
White coat hypertension. Now I think a relatively new diagnosis will be the mast hypertension. Uncommonly discussed. Not commonly discussed. Mast hypertension very difficult to diagnose. Your clinic blood pressure normal, so ABPM ambulatory or home blood pressure monitoring is high. So why we will say that you measure your blood pressure? We are not telling, but sometime intentionally patient measure the blood pressure at home. Some relatives are there. Patients are telling us that my blood pressure is high in the home. Please, doctor, check me. Then you can identify. Plus, if you will get the target organ damage, then you will be confident that yes, this person's blood pressure in the home is high, but I am getting in the clinic normal. It is an uncommon diagnosis. So your answer will be answer means the answer tips is white coat hypertension. Main treatment is the lifestyle advice and the monitor. But again, you understand that will you give the medicine or not? Yes, if patient have target organ damage, medication must be there. So this is one of the another type of diagnosing hypertension. Yes, Dr. Sarah. Any other colleague, you can raise the hand. We will invite you one by one, no problem. Dr. Sarah, please discuss this. What do you
Yes.
understand?
Yeah. Age confusion trap. AKT often confuses candidates with age cutoffs. Nice style thinking. If less than 80 years, treat if blood pressure is more than or equal 140/90 with risk or organ damage.
Yes.
If less than 80 years, if with
Risk means, doctor, risk means organ damage. You understand target organ damage. Less than
yeah
80
diabetes,
years, less than 80 years with risk. With risk means
smokers,
cardio, yes, cardiovascular
cardiovascular
risk,
Q risk,
cardiovascular
Q
risk,
risk more than
yes.
10%. Yeah,
So if more than 140/90, then will you give treatment or not?
we
Okay,
have
this
to
is one
start
thing.
because
Yes. Another thing, 80 years, more than 80
if
years.
more than 80 years, more than 80 years, treat um if blood pressure is more than 150/90. Cutoff value is a bit high for elderly.
So it is a trap question. Trap question means the trapping information.
Yeah. A trapping example is 82 years old, blood pressure is 148/88, which is less than the cutoff value. No organ damage.
Is it sure less than cutoff value?
Mm,
Why you are
yes,
confused
unfortunately,
again? Actually, you are also confused now. So examiner usually
but no
confuses the
organ damage.
candidate. Right. It is the less than cutoff value because 148 and by 88 is if it is the
90.
age is less than 80, then it is high blood pressure. But is the patient age is 82, so it is not high blood pressure, it is not hypertension. This is the matter of confusion. You see, it's a very simple thing. But in the exam situation, our candidate become confused. They forgot these digits. So, Dr. Sarah, is it hypertension?
No, no, not
No,
for this
no,
patient.
not. So, what will be the correct management?
So we have to follow up the patient and maybe annually or 6 monthly we can check blood pressure.
Yes, no problem. Lifestyle advice only.
Mm-hmm.
That means patient would not have any risk in future and not drug yet. No drug now. Okay, so there is a
Yeah.
trap also.
Mm-hmm.
And this trap could be in the OSCE exam also. Thanking you. The next. Are you tired, Dr. Sarah?
Not of now.
Hopefully no. Please,
Uh,
please go through this
yeah, hypertensive urgency versus emergency trap.
emergency trap.
Uh, yeah, they want you to distinguish situation. Blood pressure alone, meaning hypertensive urgency. Action is oral drugs. If only high BP, then we oral drugs. High BP plus organ damage, that is hypertensive emergency. Then we have to admit urgently.
This is our
Trap.
information backup. Okay, our planning.
Yes.
Now the
Mm-hmm.
trap. What trap they usually give in the
Traps.
AKT?
Mm-hmm. Trap stem is blood pressure 210/120 plus confusion or papilledema or pulmonary edema.
Then what
Confusion
will be your management now? Correct management
is
plan.
hypertension.
Now, Dr.
Yeah.
Sarah, please just wait few seconds and be
Mhm.
connected. Asking other colleague, please here. Please, anyone open the mic. What will be your decision now? Please quickly. Yes, Dr.
I
Aisha,
think
welcome, doctor.
urgently.
What will you
Ad-
do?
Admit emergent urgently.
Emergency admission, right? Because this is hypertensive emergency.
Emergency.
Emergency. So these are very important in the OSCE also. If you label the patient as such, your job is to send the patient to the emergency department. It is called the safe doctor. If you cannot become safe doctor, very difficult to pass. Very good. Next one, Dr. Aisha, would you continue this discussion? Dr. Sarah
Yes.
can take rest, please.
Yeah. This is pregnancy trap. Very common AKT trap. They offer lisinopril, enalapril, losartan, labetalol.
As a part of the treatment, okay? That means the part
Yes.
of the hypertension treatment. Commonly, they offer this thing. So, what is the answer now? Anyone can answer.
We can't give
Labetalol.
AC inhibitor. Yeah.
What,
Labetalol also
doctor?
can't. We can't give.
Labetalol, labetalol, but not AC inhibitor or ARB.
Yeah.
ARB. Try to remember it. Dr. Aisha, please continue.
Hmm. Secondary hypertension trap, they hide it in the stem. Clue, young is age less than 30 plus severe hypertension. Then think of some secondary cause. If there is some hypokalemia, so it might be hyperaldosteronism. If renal brew is present, then renovascular hypertension.
These are your informations. Commonly, they select from these informations. Now, what could be the trap now, please? Trap
Young
message.
woman
Okay, young woman.
with blood pressure 180 by 110 and potassium 3 millimole per liter.
Okay. So if potassium is not, you just forget the potassium right now from here. You think up to this. Up to this means young woman with blood pressure 180 over 100. Up to this, what is our diagnosis?
Hypertensive urgency.
No, doctor, actually, hypertension level could be
Renal diseases.
relatively higher. But by the primary or secondary, I am asking. Young woman, blood pressure 180 over 110. This is primary hypertension or secondary hypertension? More likely
Second. Yes, secondary.
secondary. Now the specific clue is potassium level. From there, if potassium level is as such, what will be your correct diagnosis? Please, other colleague, new colleague, please respond. Everybody better to share. You will feel better. Other colleague, yes, Dr. Mahbub. Mahbub, open it. Uh, sorry, Dr. Javed.
Yes, it's constant. Hyperaldosteronism.
Cons. Hyperaldosteronism. Yes, primary hyperaldosteronism. Yes, Dr. Aisha, any trouble?
Yes, okay.
Please continue the next one.
Yes, AC inhibitor side effect trap. Trap phrase is dry persistent cough developed after 2 weeks. So the wrong answer is stop all BP medications.
What will be the correct answer now?
We will change the medicine to some
Possibly
other.
patient getting one drug or two drug or three drug, we don't know. So our decision wrong if we say stop all the drugs. Okay? So which drug now? Dr. Mahbub, please, I think easy for you. Which drug?
AC.
Sorry, Dr. Mahbub. Mahbub having some trouble maybe for the audio. Dr. Aisha, you can answer also.
Yes, AC inhibitors I will be stopping.
Yes, switch to ARB.
Arts.
ARB.
Yes.
So ACE inhibitor is there, so we'll switch to ARB. Okay. Now the next one.
Diabetes with hypertension trap. If diabetes plus albuminuria, diagnosis will be
Not diagnosis, doctor.
treatment.
Treatment,
Treatment
medication.
will be
What will
yes.
medication?
Diabetes plus albumin. AC inhibitors.
ACE inhibitor. Dr. Javed,
Yes, ACE inhibitor.
ACE inhibitor. Not calcium channel blocker or beta blocker first in these setup. And this is a very common mistake. Very common mistake. Okay, because the outcome study found that more benefit by the ACE inhibitor or ARB. Again, patient have the cough, drug induced, we have to switch to the next one. The next, Dr. Aisha.
Resistant hypertension trap. Definition trap over on 3 drugs, including a diuretic, and is still uncontrolled.
So what with
Correct
the
fourth
fourth drug?
in exam.
Fourth drug in the exam means in the AKT exam. Fourth drug, what do you expect? Dr. Adris, do you like to answer?
Yes, sir. It's a beta blocker we add.
Beta blocker. Okay. Everybody agreed with this answer.
No, I think Dr. Osman should be spironolactone.
Yes, spironolactone.
But we have to
Not
check the
beta blocker.
level if potassium level is more
Yes,
than.
again, already we discussed. We need to check the potassium level. Then we will add spironolactone. So in the exam situation, usually answer will be a spironolactone. This is an hints only. Okay, thank you, Dr. Aisha. Can you take rest now? Invite Dr. Javed, please, if you're free.
Sure.
Just to describe this scenario number 11.
Blood test timing trap.
Timing trap.
Yes.
Today's topic is trap and rescue. For that, always trap word is there. Okay, please.
After starting ACE inhibitor or ARB, check U and E. Options same day, 3 months, only if symptoms within 1 to 2 weeks.
Okay.
Within 1 to 2 weeks.
So what do you understand? You just describe us, Dr. Javed.
Because usually we are concerned about potassium. So after 1 to 2 weeks.
After 1 to 2 week or within 1 to 2 week. After within, as option is given there only with the within. So your answer will be within. If you think. So does it mean same? Within 1 or 2 weeks?
It's up to 2 weeks. That
Word is confusing. It means that after 1 week, before 2 weeks. Is it? So what will be the best answer? Yes, it can be done after 3 weeks also, but preferably best timing is after 1 week, before 2 weeks. That means before second week. Ideal. As other answers are wrong, your answer will be this one. Correct answer is this one, within 1 to 2 weeks. So this is the follow-up after S inhibitor ARB. Actually, we are not doing most of the time. This is very, very fact. Next scenario, Dr. Javed. ECG trap. With the ECG. Though today, later we will show you some ECGs, few ECGs. But you know that already all of you, most of you attended an AKT question exam, recall. There are some ECG related question. Only data is given, not the picture. So think that it is such type of question or trap. Dr. Javed, please.
yes, they describe ECG, a tall R wave in V5, deep S wave in V1.
V1.
Answers include normal ECG, MI.
MI. So what could be the answer? There may be other options also, as SBA type 5 options are there. But the main key options are two. Intention, examiner's intention. Normal ECG, MI, or something else. This is the trap that you may diagnose this thing from anyone, but this may not be right also. So what will be the correct answer?
So, left ventricular hypertrophy.
Left ventricular hypertrophy, right. Left ventricular hypertrophy due to long standing hypertension, most likely. Very right. Next one, Dr. Javed.
Okay, chest X-ray trap. Cardiomegaly without lung shadowing.
So again, X-ray will be given or will not be given also. So lung shadow is not there. What is the probable diagnosis? We are dealing a patient of hypertension today, remember. All patients having hypertension. Keeping in the mind, we are discussing. Diagnosis. Anybody can open mic. Without lung shadow, lung clear. But cardiomegaly there, primarily patient have the hypertension. So diagnosis will be, if cardiomegaly is there,
Left ventricular hypertrophy.
could be. It indicate chronic hypertensive heart disease. Maybe hypertrophy there. More likely left ventricular hypertrophy. But it is not pneumonia, not tuberculosis, or not COPD. But how COPD could come actually in the field to confuse us, doctor? Hypertensive patient as well as cigarette smoker. At that time, we might be confused that patient have COPD also. But our agenda is without lung shadow. But in the COPD, any lung shadow there? What is the X-ray appearance of COPD commonly? Dr. Javed.
It's actually the size of the
Blackish.
increase, so it will be
Size has increased there, but appearance, color, black or white? More black. More black. Okay? Indirectly, we can say it is also shadow, black shadow. All right? Black shadow bilaterally. So there is no shadow. That means lungs are clear radiologically, so it is not anyone. The patient is a smoker. Next one, Dr. Javed.
lifestyle trap. They test what lifestyle change has the greatest BP reduction.
Reduction. As we are mostly, possibly today, mostly South Asian candidates, it is very important for you. Correct for South Asians, which lifestyle is most important for hypertensive patient? Possibly blood pressure is not controlled. And this is my very personal observation also. In my institute, my college, I am emphasizing personally too much, not written in the book. We discussed before also. Anyone can share. Which lifestyle? Lifestyle means, for example, smoking, alcohol, obesity, sedentary lifestyle, the dietary salt, like that. What could be the most influential lifestyle issue for hypertension?
Obesity.
What, Dr. Javed?
Obesity.
So you think the South Asian people are always not in the world, other part of the world? This is the salt. So in the advice part, again, come to the OSCE candidate during advice, though we will show you later for the OSCE separately, a few minutes later. Salt restriction number one. It means if you ignore it as an OSCE candidate, your performance will not be good. Okay? But not vitamin, not herbal drug, not fruit juice. These are not very important. Rather, number one and the very important issue is the salt restriction in the diet especially. Okay? Dr. Javed, do you have any relative having taking more salt during food?
I think yes, in our part is people are taking more salt. Yes.
More, yes. It is South Asian a special issue. Thanking you, Dr. Javed. Any other colleague want to read with us? Dr. Javed, be with us. Always we are grateful to you. Anyone? Dr. Javed can continue. Dr. Javed, please continue. 15.
Potassium abnormality trap. Low potassium plus hypertension diagnosis. This is same as Con syndrome.
We will see, we'll show the
Understood.
answer. The diagnosis you are thinking now. And then another
Uh,
scenario, high potassium.
High potassium on ACE inhibitor.
So what is your management? Your patient
Stop.
is hypertensive. Stop ACE inhibitor.
Yes.
Okay, let's see. Check urea electrolyte. Don't just stop blindly. Why? It is the reason, doctor. Very critical message here, Dr. Javed. Diagnosis, all of you understood easily, but in the management part, suddenly if I say I will stop AC inhibitor, that means we are meaning that AC inhibitor is the sole responsible for high potassium. But we are not addressing a patient overall, holistic approach. Could there be any other reason of high potassium? What is your experience, Dr. Javed? You have seen many patients. Actually, high potassium was not due to ACE inhibitor. It was due to some else. What could it be?
If taking some other drugs or maybe chronic kidney disease.
Yes, patient developed kidney disease. So ACE inhibitor is not the responsible one. Okay, sometimes proteinuria is treated with ACE inhibitor. So proteinuria is a marker of the chronic kidney disease. So ACE inhibitor we need to continue also sometime. For this reason, don't just stop blindly. Okay, sometime in our resource poor setup, as drug to stop the drug is very easy decision. We stop the drug, but it should be temporarily stoppage. We will evaluate the patient and we will think to restart ACE inhibitor later if we can find other cause of ACE inhibitor. But in real sense, our decision making will not be stop the ACE inhibitor. Clear, Dr. Javed?
Yes, thank
A
you.
relatively critical decision making by you, no doubt. Okay, try to understand it. So at the last slide of the AKT traps, it is very important. Near about 15 AKT traps we discussed with you, and these are almost common. Every AKT candidate is to face such traps or question for the hypertension. And what is the rescue means, what is the decision, already we discussed. And those who participated in the discussion, very, very thankful to you. Hope that you will be with us also few minutes later also. So this is the summary of that. In the AKT exam, the memory line for hypertension is no single reading confirm with ABPM. This is a take home message. Think pregnancy during management, think kidney and potassium, think diabetes, think three drugs if patient is using, then add spironolactone. These are the very, what I say, the topics, topmost, very hot topic, rather to say. So I think we can here conclude now for the AKT specific trap and rescue. And give me 1 minute time, doctor. We are going to the next topic.
Sir, I have one question
You have
about
question
mask
also? Okay,
hypertension.
okay. Please, please. Thank you. Mask hypertension. Very nice question. No doubt.
So, sir, do we treat
Must be
mask
treated,
hypertension?
doctor.
The
Yes,
blood pressure will
must
be
be
normal.
treated. Must be treated, especially if you get target organ damage. Otherwise,
Okay.
you will be confused, no doubt. Understand that is it actual hypertension or not? Is patient giving the record perfectly or not? You will be confused. But if you evaluate the patient further means how will you evaluate, doctor, further?
For blood pressure monitoring or for some lab test?
Whatever you need. You have already basic knowledge of hypertension. For that I am asking, what test will you do? Investigation.
Lipid profile,
Okay. Then
a renal function test,
renal function test. Okay.
and some thyroid function test.
Okay. ECG also, urinary also.
ECG.
So
Yes,
from
yes.
there you identified that there is what? Target organ damage. Okay.
Okay.
Then what will you do? You must treat
Then
the patient. You are sure that this is hypertension. So definitely you need to treat it.